ClickView enables us to identify and track people with learning disabilities through our hospital system. It allows us to be much more responsive with the specialist nurse input that we can provide. There is one of me over the 3 hospitals. I'm working very hard to be omnipresent, but I haven't quite managed it yet. But there are the systems out there in the community. We've got some really brilliant resources of expertise of the community learning disability teams that cover all of our areas.
Myself, other learning disability nurses in East Kent and Daniel have met together to initially find out that we don't know a whole lot about what each other does, and decided that we actually do need to better meet the needs of our client group, in this case patients with learning disability. And what we've done is gradually work towards an agreed protocol of working, in that if someone attends A&E 4 times per year or is an inpatient 3 times per year and has a learning disability, then they'll be referred to us.
Having a community learning disability nurse involved at the point of where issues might arise has been really important. We've been so much more able to prevent problems from occurring.
Prior to us setting up this system, we might not have found out at all about the patients going into hospital, and so some of the long-term problems might not have been resolved. But I do believe that the new system we've set up has improved the service to our patient group.
The Productive series was designed by the Institute of Innovation and Information. It was a package, an abstract package of modules that actually looked at 4 components, which was around patient safety, efficiency, staff experience and patient experience. Crystal and Chris were actually ward managers that implemented the programme, and then were invited to be facilitators. The 3 of us came together as facilitators to implement that programme across 60 wards in different specialities from ITU and maternity. And then 1 year ago, I was invited into the Productive Operating Theatre programme. I think one of the skills that we've had as facilitators is translating the packages that are quite abstract into reality. We've managed to create spaces to have communication with all our staff to empower them to take forward processes and systems that actually make a difference to them at ward level.
We were able to implement changes that we've been struggling with for a long period of time, just by being networked with the right people and knowing the right way to go about trying to implement change processes, and really empowering and engaging ward teams in making those improvements.
It means that we have the right product in the right place at the right time, which helps with the efficiency and flow of our workload and also improves patient safety within the department.
In 2010, we held a big public engagement event, and we started thinking about, well, how do we improve communication within the hospital system? How do we make sure that for those people who aren't able to give that full verbal history, how do we make sure that our doctors and the nurses have the right information to hand? From that public engagement event, we identified that there was a group of people that really wanted to take the lead with this, and so we got together for our first meeting in January 2011, and we did all these kind of exercises where we cut up bits of things that were already in place and stuck them together, and then we took what we'd done to the charity, and the charity very kindly helped us with funding. And then in January this year, January 2012, we had held a follow-up event. We had people banging down the door to try and get in. We had 100 odd people there that day, and they all gave us feedback about how good it was.
Definitely making a difference, because it makes communication easier. It's stopping repetitive questions being asked, and also the nurses and staff are prepared, and rather than, for example, if it's a patient that their needs have different needs for non-verbal communication, then rather than us creating a situation that may cause more apprehension, we can actually avoid that.
Do you think that having a hospital passport might help people with a learning disability?
Yeah, yeah, good, because hier als je the doctors,
So it will help the doctors
yeah,
learn about people when they go to hospital.
yeah.
Meeting lots of different people from different aspects of hospital care has been really good for networking and helping us understand each other. There may be that we come into the project first of all thinking, oh, these bad hospital staff, they're not doing their job. Well, actually they're working really, really hard and they've got their own pressures as we have in the community. And it's about trying to resolve how we can best work together so we can make good outcomes for people with learning disabilities when they come to hospital.
Marianne and Sue have worked with patients to really find out how it feels once patients have completed treatment for cancer. There's been really a lot of work nationally around survivorship and patients feeling quite abandoned at the end of treatment. So they worked with Macmillan Cancer Support to request some funding so they could set up a pilot on health and wellbeing clinics so that patients would be seen after completing their treatment, so they had that additional support.
Marianne and I were very much wanting to develop the service to try and meet some of those needs at that time.
One of the things that we wanted to look at was actually how we could work in partnership with other multi-professionals that work within the trust and outside of the trust. So we looked at getting a steering group together and to see who would be interested in working with us. And we were really amazed how many people wanted to work with us for this health and wellbeing clinic for patients.
The feedback that we've had following the initial pilot was very positive actually, and what is very pleasing is the patients have actually given us ideas as to how we can further develop the service, and one of the things that we're beginning to look at is to provide some support at the beginning of their treatment pathway before they start even receiving any chemotherapy or radiotherapy, which is very positive, and that idea has really come from the patients themselves.
The thing that really impressed me about Marianne and Sue was they didn't just think about their own specialist area. So they didn't just think about what support lung patients needed or upper GI patients needed. They actually thought right across the board of what all patients needed.